We'll go ahead and get started. Hi, my name is Matt Winter, and I would like to welcome you to the latest of VetCT's 12-minute take-home webinars. It's great to see so many people here. I know there's a ton of interest in these topics. VetCT recently launched our new app and our teleconsulting service, and we'd really love for you guys to give it a try. Through the app, vets get instant access to a team of really friendly specialists offering support and advice on those really tricky cases. And you can choose to communicate with a team of specialists via instant callback or text chat, book an appointment at a time that suits you, or ask for a written report. While learning on each case, anyone in the UK can also get the added benefit of some real-time CPD. So to try this, just download the app from the App Store or Google Play. We've made it really easy for you. If you scan the QR code on the screen, it will take you directly to the app. We'll have that on again at the end. It's beneficial for both vets in the clinic and locum vets, and we'll be happy to discuss this more with you. Just go to our website or contact David Moffat directly at sales@vetct.com for more info. I'm going to get on to today's 12-minute webinar. As a reminder, the session itself is being recorded, and there'll be an opportunity to ask questions at the end. So do add any questions into the Q&A section of the webinar down below. We'll answer as many as we have time for and follow up with any others after we get through the webinar. And with that, I want to go ahead and introduce our exotics team. And you see we have Dr. Daryl Hurd, Dr. Mikkel Sabater, and our very own Dr. Copper Aitken-Palmer, who is going to be giving the webinar. I've had the pleasure of working with Copper at the University of Florida. She currently resides in Florida, but as you can see from her bio, she is a global resident and has had a plethora of experiences throughout the world doing some amazing stuff. So without taking up any more of the valuable time, I'd like to go ahead and hand it off to Copper, and she can get started to talk about guinea pig cystitis. Thanks, Copper.
Wonderful. I really appreciate that intro. I'm excited to talk to you all today about guinea pig cystitis. I feel like anytime we get a call that the guinea pig has blood in the urine, there's kind of a collective groan. So I'm hopeful that we can talk through some things to make it a little bit less of a challenge. So the biggest thing I want to really talk to you about today is some information about how inflammation affects the guinea pig bladder. There's sort of an interesting study that looked into how inflammation affects the guinea pig bladder, in that when inflammation starts to occur or distension of that bladder occurs, even for a pretty short period of time, for just about 24 hours, there's actually leakage of the urine components into the bladder wall. Once those components go into the bladder wall, they actually start irritating the nociceptor fibers, as well as the detrusor muscle. And that causes pain as well as contraction at a pretty low volume of urine. And so that's something that for me was kind of an aha moment to really realize that there's changes that are occurring not just within the bladder for inflammation, but actually into the deeper tissues. And that's really the origin of pain and why these guinea pigs often act really uncomfortable when they have cystitis. And this also helped me realize that plaquuria is often the first indication that a guinea pig might have cystitis, even before you see blood in the urine. The other component of this is that because those urine components are in the deeper bladder wall tissues, even if the urinary tract infection or the urelithiasis or whatever the underlying cause is resolved, sometimes it actually takes a bit longer for the inflammation that's occurring deeper in the bladder wall tissues to resolve. And so that means they need to be on pain medications a bit longer. They need to be on anti-inflammatories a bit longer than maybe at least I would have clinically thought before sort of reading this study that really helped you understand some of the changes that are occurring in these guinea pigs. And so just a reminder that this cascade happens pretty quickly in the process of inflammation for the guinea pig, and actually can continue even longer than whenever the underlying cause has resolved. All right, so usually cystitis is going to present as hematuria and pain just for the reasons we just talked about. But I always kind of take a step back, even when I'm pretty sure the blood is coming from the bladder or the urinary tract infection or urinary tract, just to make sure where it's coming from. Because really the blood could be coming from anywhere along the urinary tract and anywhere in the reproductive tract. This is true for males and females, though the females certainly have a lot more places within the reproductive tract where things can go wrong. And it can be really from anywhere. So vaginitis, just from irritation from bedding, can cause blood to come out during the urination. And then things like endometrial hyperplasia, endometrial cysts can all cause bleeding within the reproductive tract that you see as hematuria. I do want to mention ovarian cysts because ovarian cysts are fairly common in guinea pigs and they are painful. Ovarian cysts in themselves don't tend to cause hematuria, but they are often associated with changes in the endometrial lining of the uterus. And that often those cases will have bleeding within the reproductive tract coming from the uterus, really. And that's because of some of the hormone changes that occur with the ovarian cyst. So I just want to kind of remind you that those are possible differentials if you're seeing hematuria besides cystitis. For cystitis, urelithiasis is almost always the underlying cause for guinea pigs, but I do want to mention neoplasia. I have seen a cluster of cases. There's actually 3 cases, all from the same owner, all from the same age. So I don't actually know, though, if they were related, but all 3 of those ended up having urinary transitional cell carcinoma as the underlying cause for their hematuria, and what we thought was urelithiasis related cystitis. And we actually found that at necropsy. So I just want to put that on your differential list. It's not something that's reported often in the literature. I'm only aware of one citation, and that is a group of individual guinea pigs that were related. And so I think that that's something that's, until I saw the cluster of cases, I didn't tend to think about. Vitamin C deficiency is something that can cause hematuria and changes in the lining of the bladder just by itself. So even if there's no urinary tract infection, no urolithiasis, vitamin C deficiency in guinea pigs can cause hematuria and some changes to the lining of the bladder. So that's the other thing that I always try to think about for guinea pigs specifically. So a little bit about vitamin C. Guinea pigs do require dietary vitamin C. They cannot synthesize this on their own. And it's important that they have a source of vitamin C in their diet. And typically, this is best done through diet items. And there's always lots of talk about how oranges and orange juice is the best source for vitamin C, but I know lots of guinea pigs that aren't interested in any one of those. And there are lots of fruits as well as vegetables that have quite a bit of vitamin C in them. And so I just put kiwi and bell pepper and guava juice here because those 3 actually have a lot of vitamin C. And I just kind of forget about that. So I just wanted to mention it here. I think kiwi is also called Asian fruit, but that one has a lot more vitamin C than most other fruits. And the bell pepper is actually among the vegetables, it's actually the highest in vitamin C. And 1 ring of bell pepper, so if you cut it crossways and kind of create a ring, is enough vitamin C for a guinea pig daily. So if it's getting a ring of the sweet pepper, the bell pepper every day, then it's going to be okay. If there is a deficiency in the diet for vitamin C, the animals can actually become clinical pretty quickly. So within 2 weeks of inadequate vitamin C in the diet, those guinea pigs are having changes in their connective tissues, and that can present as nonspecific lameness. It can actually present as respiratory infections, as well as hematuria. And usually it's necessary to start pretty high on dosing with vitamin C if they're at the point of deficiency. And so basically any guinea pig that's coming to see me that's sick for any reason, whether it's hematuria, cystitis, limping, anything, I'm giving it vitamin C by injection at the time of exam. And I start with a 200 milligram per kilogram dose just to make it easy. I basically give them all 200 milligrams. I do it by subcutaneous injection. And then for the next few days, give them increased vitamin C in their diet. If this is contributing to their disease, whether it's hematuria, cystitis, or respiratory infection, you often will see improvement quickly. So like less than 3 days. So it's very rewarding to go ahead and treat them for potential hypovitaminosis C. So the diagnostic approach for hematuria, or when you're suspecting cystitis, is not different than anything else. I would say that minimum database is going to include blood work as well as physical exam and history. I have CBC and biochemistry in here, but I recognize that sometimes it's not easy to get blood from a guinea pig. And so if you're going to prioritize diagnostics, it would actually be getting a urine sample, and getting that urine sample by cystocentesis is going to help you a lot to know where the blood might be coming from. So if you collect urine via cystocentesis and there's no evidence of blood or scant blood in that, it's probably coming from either lower in the urinary tract or from the reproductive tract. And so I find that this is a really great place to put your diagnostic efforts. And the other thing about collecting urine via cystocentesis is that you can then run a culture and sensitivity, which is really something I urge you to do to guide therapy. And that's because there's just a fair amount of antimicrobial resistance among the pet population, at least that I'm seeing. I do see that TMS, or trimethoprim sulfa, is one of the antibiotics that seems to sort of rarely have resistance, at least for urinary tract infections for guinea pigs. So that's often where I will start while I'm waiting for the culture and sensitivity results. Just like other mammals, the crystal types that might show up in the urine may or may not be reflective of what is of any stones that might be happening within the urinary tract. So as I'm considering diagnostics, imaging is always at the forefront of my mind. And for most mammals, I actually start with radiographs, but not for guinea pigs. So for guinea pigs, I actually start imaging with ultrasound. That helps me get that urine sample for cystocentesis. And then it also will allow me to look at the entire urinary tract and also look at that reproductive tract. And so this is, I would say that urinalysis coupled with ultrasound is basically my first line for diagnostics for guinea pigs that have suspected cystitis or definitely have hematuria. If it's never wrong to do radiographs, and so it's often I will do that in addition with ultrasound. But the reason I don't, I guess I don't like radiographs quite as well as ultrasound for guinea pigs, and that's because there's so much going on in the caudal abdomen of guinea pigs. So there's a lot of gastrointestinal tract to look through. There are a lot of small bones associated with the pelvis. The male guinea pigs do have an os penis, so that can obscure ability to look at for urelithiasis. And I put this picture up here where you actually can see the urelithiasis, a pretty big stone. But that particular image has the very caudal portion of the pelvis cut off. And that is not ideal. And the reason why I would say that is because somewhat frequently in guinea pigs, the stone is actually pretty caudal in the urinary tract, and especially in females. I've definitely pulled out quite a few stones that are just kind of sitting in the caudal urethra that you can actually remove or extract just with your fingers. And so I always make sure to include the caudal pelvis, the entire back end of the guinea pig, for radiographs. My favorite, though, over radiographs and even over ultrasound is actually CT for guinea pigs. And that's because they're just so easy to CT. So this little guinea pig is actually one that ended up having the transitional cell carcinoma. And she was great about being still, just popped her in this little box. I put actually some, like a small towel behind her rear end, and then put her through the CT tube. So she did not have to have any sort of sedative or anesthesia, which is great. And the other thing that I love about CT is it's so powerful that it could see multiple areas that had issues. So this individual actually also had gallstone precipitate, which is interesting because there are studies that show that chronic hypovitaminosis C in guinea pigs can lead to gallstone precipitate gallstones or precipitate in the gallbladder. And that is important to know because that means that there's room for improvement in the husbandry. This individual also had bilateral shoulder arthritis. She also had a stone. The stone pictured here is actually quite large, but interestingly, we didn't see the neoplasia actually until necropsy for this individual. So a little bit about urelithiasis in guinea pigs, just because it's so common. The stones that are present are almost always radiographically visible. They are most of the time calcium carbonate. I kind of pause a little bit when I say this because there's definitely conflicting literature, and that we used to think that they were predominantly calcium oxalate. There are some newer studies that are showing that the calcium oxalate and calcium carbonate can look similar on microscopically, as well as some of the other methods used to evaluate stone composition. Clinically, I'm not sure it really matters, because basically you're going to need to do surgery to get them out, no matter what they are, whether they're calcium carbonate or calcium oxalate. Historically, we thought females were overrepresented, but really newer studies are showing that it's both females and males that have urelithiasis. And that's important to note, because I think that we didn't hunt for it as thoroughly in the males that we did in the females, but now we really should. So in this picture here, so in this radiograph, it's a lateral radiograph. You can see quite a bit of precipitate in the bladder. And then interestingly, there's actually, it almost looks like there's 2 os penises in this male, and that's because the urethra is just packed full of precipitate. And then you can actually see the os penis below. So that I think is just a great image to illustrate some of the challenges as far as obstruction with urelithiasis for the male guinea pigs. Again, surgery is just the best option for removing these. All right, so just kind of in summary, cystitis usually is going to have hematuria, and it's important to know where the blood is coming from. Is it coming from the urinary tract? Is it coming from the reproductive tract? If you think it's coming from the urinary tract, then look for urelithiasis. In my mind, it is urelithiasis until proven otherwise. And the guinea pig may need surgery if the stones are very big at all. And it will also be important to treat the secondary bacterial infection. Again, culture and sensitivity is what I like to guide therapy, but I often start with a trimethoprim sulfa type of antibiotic to start with. Treatment beyond antibiotics includes vitamin C always. I use anti-inflammatories as well. And then analgesics are so important for these guinea pigs. Guinea pigs are not very stoic. And so if they're really painful, then I start with buprenorphine and then get them started on gabapentin as well. And then kind of wean off the buprenorphine and then continue the gabapentin until they are pain-free. And just a reminder, I tend to go quite some time on the gabapentin to help them have less pain, because if they are painful, then they're at risk for ileus, which is a whole nother 12-minute talk. I used to use a lot of tramadol in guinea pigs, but the more recent studies are showing that it's probably not effective. So these days I'm using buprenorphine and gabapentin. And that's it. I appreciate your time.
Thanks so much, Copper. We have time for some questions if anybody has some. Copper would be happy to answer some of them. We'll just wait a second or two and see if anybody pops one into the Q&A box. Keep an eye on it for a minute. Oh, here we go. I've got a question here, Copper, that asks, what was the vitamin C dose?
Yes, so the daily dose is around 20 milligrams per guinea pig, but when you suspect a deficiency, it's 200 milligrams per kilogram. Most guinea pigs are going to be about a kilogram, so I just do 200 milligrams per guinea pig. And I usually do that for maybe 3 days, maybe 7 days. And it kind of depends on the case. I'll try to go back to the slide a little bit. But there are several different ways to give that guinea pig vitamin C, elevated vitamin C for a few days. And I usually use human grade vitamin C oral options. And so depending on where you are in the world, there's going to be various options, but my current go-to are actually the emergency packets. And so for humans, at least in the US, they make these as kind of like an immune support. Their almost exclusive ingredient is vitamin C, and it comes as a powder. So I can make it as concentrated as I want, or I can sprinkle it on a diet item. And again, I just try to hit that 200 milligrams daily for usually about 3 days, maybe 7 days. And then after that, they should have adequate stores to just go ahead and go with regular nutritional levels.
Great, thanks, Copper. There's actually quite a few questions. We'll maybe do 2 more and then we'll answer the rest via email. So the next question was, do you see a role for PMS gags in guinea pig cystitis?
That's a good question. I think that there could be a role. I am not aware of any research looking into that at this point. But I think that there's room for a lot of improvement. I think right now, basically the only anti-inflammatory I'm using is meloxicam, and surely there are other options that may be better, especially knowing that the cystitis can be almost a chronic condition with some of the changes to the deeper tissues. I do wonder if there's room for other therapies.
Great. And in the interest of time, I'm going to select one more, which is, what are your recommendations in prevention of cystitis and or urolithiasis?
Oh, I don't have a lot of great recommendations. So basically, keeping the guinea pigs really well hydrated is the number one recommendation, and there is science to support that. And offering fresh fruits and vegetables and leafy greens helps with hydration. And then the next best recommendation is to decrease the oxalates in the diet. Now, this comes with a little bit of caveat, as that was the recommendation when we thought the majority of the stones were calcium oxalates. That may be less important now that we know we believe they're calcium carbonate. And so because of that, the recommendation is to reduce the amount of calcium in the diet. And so things like alfalfa are really high in calcium. Some of the dark leafy greens tend to be high in calcium. And so dietary modification. And then the other thing is just having really astute parents of those guinea pigs. So I think client education, letting them know that plaquuria might be the first thing they're actually seeing before things progress, would be the other recommendation that I have.
Thanks, Copper. That's great. So that was really awesome, really interesting. I hope all of you found it as interesting as I did. As a radiologist, I definitely like hearing the clinical side of things. I hope you found this session useful as well. Please keep an eye out for any future sessions. Next week's webinar is at 1 p.m. BST with Dr. Lisa Smart, who's an ECC. She's going to give an ECC webinar on the essential tests for abdominal fluid analysis. Please register ahead. The recording of this webinar will be available on our website and on YouTube shortly. And also don't forget to download the app to gain quick access to VetCT's team of specialists. We'll leave the screen up for just a few more seconds so you have time to scan that QR code if you need it. And if you have any questions, you can reach us directly at sales@vetct.com. Thanks again. We look forward to seeing you. Have a great evening, and we'll see you soon.